Hi, everybody, and a huge welcome to the Family Hubs Network's Outcomes Framework webinar. I am Samantha Callan. I'm the director and the co-founder of the Family Hubs Network, and it is terrific to see so many people. Catherine just give me the numbers, over 50 joining the event already, and there's so many more to come. 100, my goodness, that jumped very quickly. But I know more people are joining. So before I introduce our presenters and I run through the topics that they'll cover, I'm just going to take a few minutes to introduce everyone to the Family Hubs Network. We and others have been championing Family Hubs for, feels like 100 years, but it's actually about 15 years. And new hubs are opening up all the time through bottom-up change in how family support is locally provided. And we set up the Family Hubs Network as an infrastructure organisation to help grow and give shape to this emerging movement and to bring it to the attention of policymakers and commissioners at a local and national level. And this bottom-up movement provided us with a strong foundation for saying to central government, you should get behind this groundswell of change. It's not an overly prescriptive solution. It's a set of principles to work to locally that could transform outcomes for families. Relentless advocacy along these lines and working with over 60 family champion MPs led to the Conservative Manifesto commitment to champion family hubs. And very encouragingly, so far, there's about 20 million early funding, we're hoping for more, in total for evaluation, for piloting good practice in information sharing and digital support, and of course, the National Centre, more on that in a minute. We connect those running the existing 150 plus family hubs to each other. We advocate for the spread of family hubs across local authority areas, and we provide consultancy services to councils who want to develop family hubs models. But we also disseminate news about innovative and effective work, examples of good practice, journeys of system change, and how local authorities have formally and informally evaluated their progress, hence today's webinar. And from the moment we opened our virtual doors, members of the Family Hubs Network have been telling us how helpful it would be to them if we provided a forum to discuss outcomes frameworks. So our aims in holding this event are first, to enable all local authorities and their partners to become more confident in setting and delivering meaningful outcomes, and to learn from others who may be a little further on than them in the process. And second, our intention is that today's presentations, your questions, and the ensuing discussions contribute to subsequent development of guidance and templates, which we will help to make publicly available. So this is very much a co-production exercise that will carry on after today, ideally with the involvement of the brand new National Centre for Family Hubs and Integrated Services based at the Anna Freud Centre. And it is great that Kate Dalzell and Florence Ruby from the National Centre have been able to join us today. And in true wedding telegram tradition, they have sent through the following message, which we are really happy to share. Hello from the Anna Freud National Centre for Children and Families, where we are delighted to have been commissioned by the Department for Education to provide the National Centre for Family Hubs. Our website, this is Anna Freud talking still, which is at annafreud.org/National Centre for Family Hubs, goes live at 4 p.m. this afternoon, and we hope you'll engage with us through that. So this is a really big day for the Family Hubs movement, what we're doing now, and that website going live later. And I'm hoping their website will make it a bit clearer just how exactly they'll work with local authorities. And we're going to send out that URL later because I could only talk very quickly about it now. I'm sure you could Google it. But given the Anna Freud Centre's towering reputation for evidence-based practice, outcomes and frameworks for tracking these will be very important to them. So thank you from the outset to all of our presenters who are really good friends of the Family Hubs Network. And they have on numerous occasions tirelessly shared their insights and their learning with us, the central government, the Children's Commissioner, the Independent Care Review, and many other local authorities whom we pointed in their direction. And the structured presentations we're sharing today, they really explore the process of creating an outcomes framework, but they also provide important insight about how to develop a family hubs model in the wider sense. So we are delighted so many local authorities, now 135 people, have joined us today. And these represent very many local authorities. 155, it keeps going up. Anyway, each of the presenters could actually provide a webinar in their own right. So our presentations, the presenters today have actually quite a tricky job of distilling detailed journeys into their 10 to 15 minute slots. But their slides, as I say, we're going to share them afterwards, will be incredibly helpful. So, as you know from the invitation, we're covering the following stages. Carolina from Plymouth will lead off with, where do you start? How do you conduct a local consultation and needs analysis? Then I'll invite Richard, Adrian and Hayley from Essex County Council to describe deciding strategic outcomes, developing the underlying theory of change, and identifying the relevant cohort watch to measure and how. Following on from them, Denise Beavers from Doncaster will pick up developing the system and deciding relevant interventions. And you can tell there's a bit of overlap deliberately in these themes. And she'll also talk about determining intervention level outputs and outcomes. Simon and Rachel from the Isle of Wight will finish with collecting data and reporting. And in a good Zoom tradition, whilst they're presenting, please submit your questions in the Q&A, and that's only going to be visible to panelists, I'm afraid, so don't be surprised if you can't see anybody else's questions. So I think you're all very familiar now after a year of Zoom, just how it all works. So I'm going to hand over to Carolina Hall from Plymouth to kick off with, well, where do I start and how to conduct a local consultation and needs analysis. So thank you, Carolina, and we're going to have the slides. Thank you.
Thank you. Okay, thank you everyone. Thank you, Samantha, for the introduction. My name's Carolina Hall. I'm from Strategic Commissioning, Plymouth City Council. We're at an earlier stage than some of the other local authorities. We haven't established family hubs yet in Plymouth, but I would like to talk to you about the first stages that we've been through so far. Next slide, please. So where to start? I mean, the first place that we started was to put together a key stakeholder group, making sure they had wide coverage for all sectors, not statutory and non-statutory, making sure that we had a wide range of professionals and also organisations that covered some of the key areas that themes within the family hubs. We made sure that that group then agreed terms of reference so we could take that forward and make sure that there was the right people around the table to make the decisions and carry the agenda forward. The next stage, we had a commissioning strategy, which was wider than the family hubs, but included the family hubs as a sort of test to see whether people were receptive to having family hubs within Plymouth. And they were, so that was a good start. We also researched other models of what other local authorities were doing, how other places were rolling out family hubs. As I said, other places were further forward and had already implemented family hubs, so we did some research into that area, and we also liaised with the family hubs network as well to understand what other things have been happening in other parts of the country, take that learning on board as well. We also made sure we had an integrated approach to how we were delivering. So we looked at different interfaces that could be happening with other programmes in health, DWP, Department for Education as well. So there was read across to troubled families and to things like the reducing parental conflict programmes as well. So obviously each local authority will be slightly different, so you just have to adapt to your own individual circumstances. Next slide, please. The next stage in terms of, well, before we started with any engagement, we wanted to make sure we had a really strong co-produced communication engagement plan, and making sure that we had the key messages agreed and making sure that they were targeted to the different audiences that we'd identified. As part of that, stakeholder mapping was a large part of that, making sure that we understood who the key stakeholders were, both internally, externally, professional and non-professional. So families obviously being key stakeholders within that, and children and young people as well. making sure that we involved people that would be involved in the direct delivery of the family hubs, and those that were on the periphery, so those that would just interface with it but were key partners within that as well. It was really important to keep those people on board and make sure that they understood the direction of travel, because the impact of the family hubs is wider than the delivery of just the family hubs as well. It has quite far-reaching implications to the wider children's system, so we wanted to make sure that everyone was involved at the earliest stage possible. Next slide, please. Okay, this is just an example of how we set out our action plan. So we wanted to make sure we had a variety of channels to go through. We wanted to make sure we maximised the reach into the community. So we realised that some people were obviously very digitally literate, so we put stuff online, but we recognised also that some people would read about local events and local issues within their free papers. And didn't have access to a computer. So it was about trying to reach as many people as possible through different methods. We did visits to children's centres as well as co-design workshops and things like that. So it was just making sure we had a range of activities to maximise the engagement within those stakeholder groups, and then trying to tailor some groups that were considered to be more difficult to reach. Also, that shouldn't be underestimated, is that although we had a plan, one of the most important things with this piece of work was to engage with people in an unplanned way. I recognise that the last year has made that fairly difficult because there's less face-to-face opportunities, but actually just that little discussion before a meeting or after a meeting or in the corridor or at an event when you're sort of preparing and waiting around in the waiting area and you can have a chat with people, actually getting those messages and getting that informal kind of feel out there for how people are feeling about family hubs, what kind of issues are arising within the system, and it's a really good way of engaging with people. So just consider both. It doesn't always have to be planned activities. Some of the best information you get are from unplanned sort of interactions with stakeholders. So just take advantage of that, really. Next slide, please. This is the brief engagement timeline. I realise it's a bit small. You'll get copies of these slides so you can have a look through it in more detail. But essentially, we wanted to make sure we had a consultation prior to taking a business case forward. So we wanted some information about how we could take it forward, whether there was the appetite locally to make sure that family hubs were going to be something that people actually wanted, families themselves and professionals, and how it would work, how it could be implemented. And we did that, and it was a really good response. We then put that into a business case, and we then got approval to take it forward to a formal statutory consultation for the children's centres. And then in parallel with the statutory consultation, we did the engagement of wider stakeholders as well. And that was taken forward into a draft specification, which included a very high-level outcomes framework. Then we did some more co-design workshops. We built up how that specification looked in each of the elements, the processes that we might use and how they'd interact, and also the outcomes framework, and the design on that was taken further forward. Then obviously COVID happened, hit, and there was some delay, but we continued to do that sort of informal work and building on the lessons that we've learned through the COVID period as well, which is going to be really important for the COVID recovery, and family hubs will be an important part of that. And then now we're in the process of developing and procuring a innovative partnership to take the family hubs agenda forward in Plymouth. Next slide, please. So for the needs analysis, we did a comprehensive, when I say we, sorry, public health colleagues did a comprehensive needs analysis of postcode level data for different indicators within the areas in our local authority footprint. So we have currently we have children's centre clusters. We're going to be aligning them to the health localities, of which there are 4 at the moment. So it will make it better for integrated working within our local area, and that's how we conducted the needs analysis based on the future locality model of aligning with health. So we looked at different indicators, and what we wanted to do was have a balance between protective factors and risk factors, because within the family hubs we wanted to have a strength-based approach. So we wanted to make sure that the positive factors that we could build on would be identified as well within each of the areas, not just the areas of risk. And that was something that we wanted to focus on in terms of early intervention prevention, and it would help us to focus the work within each of the localities and even more specifically neighbourhoods. So if there were particular issues within certain neighbourhoods or strengths, then we could focus on that, and the family hubs would help to deliver that work within those areas. Next slide, please. So we did some broad, we had some broad demographic information and indicators to do with indices of multiple deprivation and areas like that. So indicators that are already available to everyone. We looked at some basic information related to population data for the age group that we were targeting, so 0 to 19. Then what we did, we split the needs, the indicators by the themes of the family hubs. So the first one being employment support and childcare. We looked at those relevant indicators for that within our local authority. Some of this information is collated on a national basis, and some of it was collated on a local basis. So we had a combination of different information from health, education, social care. Next slide, please. Health and development is the next family hubs theme, and we looked at various things from early years, primary school, secondary school, etc. So we wanted to make sure we had that wide age range, and we also incorporated learning from what we called the health-related behaviour survey, which is a 2-year public health survey conducted within schools, so that we got the voice of children and young people within our needs analysis as well. So that's a consideration that you might like to make, about other data sets that could be brought in to reflect not only what is being presented within services, but what young people are saying about the services that they want as well. Relationships, support and family stability, again, another key theme of the family hubs. And as I mentioned before, we wanted to have a mixture of positive, protective and risk factors within the indicators. So we went for low and high self-esteem, low resilience and high resilience, and then saw what areas in the city that showed that those areas were most prominent. So that was quite an interesting discovery. And yeah, so there's other things in there related to the reducing parental conflict, domestic abuse, and things like that as well. So again, that was really interesting to see how that correlated across the city. Next slide, please. Okay, and the final family hubs theme, supporting families with complex needs. Again, across all age ranges, we wanted to incorporate the learning from the troubled families as well. And we had data sets from that. We also had data sets from children's social care and the missing persons return home interviews, etc. And the most important thing that I'd like to say when it comes to this needs analysis, although you'll get these slides and you can see the areas that we looked at in Plymouth, there may be other areas that you've picked up on in your area that may require you to look at different protective factors and risk factors, and the family hubs being the vehicle to sort of minimise the risk and maximise the protective factors. And also the learning from COVID. Obviously this work had been done pre-COVID, so one of the next exercises we'll be doing is just reviewing and seeing if there's any significant changes in any of these areas, taking on board that COVID has happened, and we need to take some learning from that to carry the family hubs agenda forward. So that's the only other thing, that if you're doing this now, you've got the advantage of having the COVID data in there as well. Okay, next slide, please. Oh, that's it. Thank you for your time, and if you and if you would like to contact me, my email address is there, so you're more than welcome to contact with any questions. Thank you.
That was incredibly helpful, Carlina. Thank you so much. I could pick out all sorts of things. I want to just to say, frankly, the timeline was really illuminating. I know that we had COVID in there, but just shows how long it takes, even with a lot of it. I know how much energy you brought to this process. It doesn't happen overnight. Second, I loved what you said about unplanned engagement, the need to be opportunistic in the way we talk to people, and that way you really find out what they think rather than through a formal process. And third, it was great to see the importance of relationship support and the use of family stability indicators. So we don't just do parenting, basically. So anyway, I could talk a lot about your presentation. It was so interesting, but I'm going to hand over now to Richard, Adrian and Hayley from Essex. And as I said before, they're going to talk about deciding strategic outcomes, developing the underlying theory of change, identifying the relevant cohort and what to measure and how. Thank you so much.
Thank you, Samantha. Adrian, I'll let you start and I'll come behind you.
Thank you very much, Samantha and Richard. Next slide, please. So just as I guess a indication of how we can celebrate the diversity of different ways of approaching this particular issue, I think we took a more organic, or dare I say, as Commissioner, less organised process than Plymouth undertook. But actually, hopefully we will complement what you just heard. So I'm going to be talking a little bit about culture, probably more than detailed process and how important that is. So begin with the end in mind. Stephen Covey, 7 Habits of Highly Effective People, is absolutely critical. We sat in a room, we parked the national specifications on 0 to 19, and we said, what do we want to achieve? And that was a very powerful and a very profound experience. We had people who were actually got quite emotional about it and said, this is the first time I've had an opportunity to influence what I do and link what I do to achieving a meaningful outcome. So that was a very, very important thing to do. We didn't start with what we currently measure. Again, that's really, really important. We didn't assume importance of the status quo. We recognized there was cultural attachment of a lot of people to the status quo. And I think that's important to validate, because a lot of people have invested a lot of time and effort into achieving the status quo. So we can't just dismiss it, but there is very much a cultural journey of taking them with us as we try to change it. So our ambition and our strategy is really very simple. Define the outcomes we want, find the best possible proxy measures we can of those outcomes. And then this one is around, the last one's around the strategic resource allocation, a strategic focus on those most at risk of not achieving the outcomes. And what that means is we need a lot more flex and a lot more creativity, whereby people who are not at risk of achieving the outcomes, they should get less. As I've said in the slides, I'm not a fan of the phrase universal service. I think that is not as, that is too risk averse for what we need. And again, it suggests homogeneity of need across the population. And whilst we can have a universal service and then a targeted service and then an enhanced targeted service on top of that, I don't think that goes far enough in terms of looking at the strategic redistribution of resource that we really need to look at. Outcomes and priority groups defined by listening to people and a traditional evidence base. But just to pick up on a couple of things that Carlina from Plymouth said. So there are lots and lots of data sets out there that we know too well, but they're not definitive about the need that, that is out there. So 2 examples of that. One would be, we don't have a definitive data set about the type and amount of COVID-related need now and coming down the track in terms of a post-pandemic crisis response. And then another data set that we don't have, which again, really interesting to see that Carlina picked up on, was resilience in the population. So I would love to have a heat map showing high and low resilience across Essex of the population, and then to be able to commission that accordingly. So we are partway through the journey. And just to give the example of how we're partway through, again, just to pick up on something else Plymouth said. So under 5s going into hospital for multiple tooth extraction under general anaesthetic. As Richard knows too well, we've commissioned Essex Child and Family Wellbeing Service to deliver outcomes. Richard is not the only, not just Richard, it's not him, he's got wonderful staff under him as well. All the staff, it's not just their job to make a contribution to an outcome. And whilst we can do things like supervised toothbrushing schemes, we can do lots of oral health promotion, if we are not also working with NHS England, working with dentists to make sure that there is availability and that dental practices are welcoming young children in for early checks, and we are influencing the overall commissioning process, then we are not going to succeed in achieving that outcome. Next slide, please. Thank you. So developing the underlying theory of change. So when Catherine said to me, can you talk about your underlying theory of change? My response was, I'm not really sure that we have one. And again, so a bit of an organic process. But what we did have, and this to me is utterly non-negotiable, a relentless focus on outcomes, even if the methodology was unclear. Now, both Richard and I signed a contract where there were things that were undetermined. And at the time, that felt a little bit uncomfortable, but thank God we did, because what we were absolutely passionate about was achieving the outcomes, and we needed to keep a degree of flexibility about the methodology and the processes by which we achieved that outcome. What would have been a terrible mistake would have been to nail it down in absolutely precise detail and key performance indicators at the start, which would have hampered our ability to undertake the exploration that we've needed to undertake. So organisational capability, again, I think this is a key thing in terms of culture. So we need key processes to turn out into meaningful KPIs, but that's only half of it. You then need a culture that's signed up to deliver it. And I'm going to quote a phrase that's used in business very often for very good reason. It's Peter Drucker, and it's culture eats strategy for breakfast. But it's absolutely true. No strategy is worth anything at all unless you have a culture of workforce, commissioner and provider that goes right from the top level management right through to a frontline practitioner, where they believe in the culture and in a shared culture towards shared outcomes. So that is that's work in progress, very much so, but it has been a really heartwarming, a very rewarding process in seeing the way that practitioners have opened up when we've given them to think about, you don't have to do it the way you've done it in the past. What we've got is the outcome here, but how we do it is up to you. And when you give people freedom to think about that, what comes out is amazing, quite frankly. So I will pause there and hand over to Richard.
Thank you, Adrian. Catherine, if you can just move to the next slide, please. Thank you. I'll just talk a little bit more about the process as Adrian set the scene for the vision and ambition for outcome measures in Essex. In order to shift away from purely focusing on activity measures or KPIs and focus on what we want to achieve for individual families and communities, we did need to go on that journey. So as described by Adrian and Carlina, Essex County Council had undertaken a needs analysis and identified the outcomes it wanted to achieve for the population. But we spent 12 months defining what the actual outcome would be and defining what the numerator, denominator, how it would be applied, what measures and interventions would be applied, and how it would be presented in a meaningful way that justified the investment and the work that went into it. So as Adrian said, I don't think we would have achieved an outcome measures framework culture unless we'd been through that journey of development. And that took a minimum of 12 months for us to do that. But it was key to bringing the whole workforce on board in moving from a very traditional, let's say, public health nursing model of service delivery to a multidisciplinary, multi-agency outcome measures framework. And what helped move that along was this psychological shift from, rather than doing to or teaching people how to do things themselves, is more a gentle coaching and showing them the way and helping them take ownership for their own future, essentially, but for their own care needs with the support around them. And that's a very big shift in culture, particularly for those that have come from a strict health background. So the journey, we're still, as Adrian described, partway on the journey, but I would argue that our workforces holds greater emphasis now on the outcome measures that we work to in the outcome measures framework. We have 27 outcome measure targets in Essex. And whilst it's not dismissing the importance of some of the standard or traditional KPIs that we naturally inherit in reporting to the Department of Health, it's clear to me that staff are now more interested in what they achieve with families rather than what they do with families in terms of the activity. And actually there's great pride as we work through the year in approaching our outcome measure framework and targets. There's great pride in individual teams and individuals themselves in the number of families that they've helped in a meaningful way as demonstrated through the outcome measures framework. So I'm going to park that there, and I'm going to hand over to Hayley to talk more about the transactional approach to achieving outcome measure framework. We move to the next slide, please, Catherine. Thank you.
Thank you. Okay, so this part became the challenge. How do you record and in a meaningful way and then illustrate the outcome? We're used to reporting on KPIs, counting very much around the cohorts, but actually outcome measures is a very different, recording the impact becomes challenging in how you do that. So in Essex, all of our staff record their work on System 1, the electronic record, which I'm sure might be familiar to a lot of you. The outcome measures are recorded by way of a care plan. So it's looking at the need identified, what is the aim and the goal of the outcome measure, and the action and the support plan that is needed to actually support that identified need. And then reviewing visits, because we want a measure at the beginning and we want the measure at the end, and then we want that to meet up in the middle. So we've got that real journey of change so that we can clearly note the impact, and it's not just about going back to counting a number. I think that's what you have to be really careful about, is making sure that it remains meaningful. It's actually on the client's record as such. Then noting down the conclusion, so the impact following support. So you can really see if anybody, is going into that client's record, see a clear journey and pathway of the support that's taking place. And the beauty of the care plan is that it's an integrated care plan. So it's not child and family wellbeing practitioners that work to that care plan. We have our third sector partners that work alongside us. So some of our subcontractors and volunteers. So it's taken some time, but we all work to the same plan. So actually it reduces duplication. It makes sure that whether you are the health visitor, whether you're the volunteer, whether you're our third sector, everyone's playing a part in that journey for the families. So therefore it's more meaningful to them. So the care plan is very much, it's owned by the family, and a lot better impact comes out of that because it becomes a lot more meaningful for them. So when the care plan is developed, it automatically prompts our protocol system in System 1. So it launches one of our outcome measures. So each individual care plan is linked to a relevant outcome. So it could be around school readiness, it could be around safety, it could be around perinatal mental health, emotional well-being. So whatever, all of our 27 outcomes would be individually linked to a care plan. The care plan can also be linked to more than one outcome measure. So rather than each practitioner having an individual care plan, as I say, it will be one care plan with everybody working to that. So everyone can see at a glance what their part is in that. So it reduces the amount of times the family have to repeat their story. So it really, sorry, Samantha.
Oh, just coming up to the end of your time, Hayley. Just 2 or 3 more minutes,
Okay.
if that's okay.
Okay, that's fine. So care plans are reviewed at the end of the journey, so we can track and evidence the progress that's been made and whether there has been a positive impact following support. Next slide, please. So just to come back to, the traditional KPIs, they still do play a big part in the way that we can identify some of the outcome measures. So they're our key contacts, really, looking at the 6 high impact areas. So very much focused around the identification for outcomes. So we do have ad hoc contacts where we might identify, or someone self-identify and ask for support. But otherwise, we do have a lot of outcomes that are identified through using the mandated contacts. So I think that's me done. Thank you very much.
We just go to the final slide and just demonstrate.
Oh, I'm so sorry. So sorry. I was trying to hurry there. Okay, so this is one of the slides from our outcome measure annual report. As you can imagine, it is quite a challenge to report the outcome measures in a meaningful way. So we try to evidence that on the number of initiated outcomes, so that's the number that were identified for support, the number of families or clients that complete support, and then how many of those had a positive impact following support. So you can see the red column is those that were identified, the green is those that complete support, and the grey is the ones that had a positive impact support. And the blue 217 there is outcomes that are abandoned. So that could be where clients have moved away, transferred out of Essex. Therefore, we would end the outcome, and when we hand over to the new area, then we would notify them of any work that we've been doing with the client.
Thank you.
Sorry, and lastly, I'll just wrap it up now. You can see the numerator and denominator on there. So every outcome, it's around, this is school ready, but what does that look like? So actually having a clear numerator and denominator. So this particular outcome is identified from the 2 to 3 year review, and those that are not meeting an age appropriate level of development from the ASQ, then we would identify them on the school readiness pathway and they would go on to this outcome 5. And I think that wraps me up, Samantha. Thank you.
That was great. Thank you so much, Hayley. And that final slide was so crisp and clear about good ways of presenting information, and it touches actually on what Isle of Wight are going to be saying at the end about how you report. Very quickly say, I love the challenge from Adrian about the universal services suggesting homogeneity. You get, again, just as with Carleen, there's such a sense of this being a journey of change, the importance of culture, and music to our ears, that this is about families developing and owning the care plan. Somebody said to me yesterday, an MP, family hubs are paternalistic. And I thought, not the ones I've seen. They involve families at every stage. This is about helping them help themselves, not telling them what to do. So moving on, really delighted Denise Beavers from Doncaster can join us. She's going to cover developing the system and deciding relevant interventions, and also determining interventional level outputs and outcomes. Again, a bit of overlap there. So over to you, Denise.
Okay, thank you, Samantha. Really interesting listening to other colleagues and making me think that our model was definitely organic and much more simpler how we came to the end point, and we're still not at the end point. So just to say, I don't think we've got all the answers to evidencing the outputs and outcomes, but this is our journey so far. Next slide, please. So we really started in about 2015 when our children's centres were designated, and we created a group model. And we first launched our children's centres in 2017 and rebranded them as family hubs. We wanted the vision that it would be the go-to place for children and families. And that's the strapline that we've had for all our family hubs. And the other key phrase is services working in and through. So it's not just our team, our small team, because we've got quite a small team of staff that are employed directly by the by the family hub. It's about lots of other partners that support us in that delivery. And although Adrian just said about universal services, what we tried to aim is that the universal services that we offer in and through the hubs are mainly for 0 to 5s, but the targeted services are for the older children, which are based on local need and any gap analysis that we've got. You can see there the strategies that influenced us and led us into our service plan and what we were going to offer within family hubs. So we use the key headings that a couple of the other presenters have alluded to from the family hub report around the 4 main themes, and we based our service offer around that. So underneath those key headings, they were the things that were provided in and through the family hub. The first 1001 days was absolutely key to us, because I think all of us realised that those first 1001 critical days are absolutely so crucial in getting support for families at that early point. So that was one of the main areas of our service plan, along with the family hubs, but also our troubled families in Doncaster. We call it stronger families, and that was a key part of introducing our vulnerable families to the family hubs. Next slide, please. So the next part of our journey was to develop a performance framework. So we'd got our service plan, we'd got the things that we wanted to deliver, we'd got the majority of partners that was going to support us in delivering that offer. But then we needed to look at how we could performance manage that and see how we were doing. So we started to begin with a very simple spreadsheet, basically. We'd got lots of data. Adrian talked about all the data that they'd had in Essex, and that was similar for us. We'd got all the demographic data. We'd got a lot of local intelligence that we knew about our areas. We didn't want to throw the baby out with the bathwater around the children's centre framework. We're always worried that Ofsted might come along, so we needed to be mindful of that. So we started with a very basic framework of membership, access and engaging, as we used to do when we were children's centres, as a starter for 10. And then we identified more vulnerable target groups. Over 60% of children in Doncaster live in disadvantaged homes. So we needed to make sure that we were at least targeting and engaging with our most vulnerable families. So that was one of our key target areas. The other one was to engage with, and this came from our children and young people's plan, that babies were a member of the family hub, or as many as we could possibly get were a member of the family hub by the age of 8 weeks, because we knew once we'd got that baby's details, then we could contact that family, and we'd got consent from the family. The framework, we work across 4 localities. So the framework was for the borough, then down to 4 localities, and then down to each of the 12 family hub areas, because we needed to look at the differences within those areas to make sure that we were working with and targeting those families that we needed to. We did at this point start to collect some data from some of our partners. So some of the data that we'd got within the local authority around 2 and 3 year funding, children that are open to social care and early help, we counted as part of our performance framework. Next slide, please. The next part of our journey was to develop a quality assurance framework, and this helped us to identify some of the outcomes and where we needed to count the impact of what we were doing. So you can see there that you'll be familiar with all the parts of a quality assurance framework or timeline. But I think the key parts of this was the self-evaluation form that helped us to identify what we were doing well, and what difference we were making. But also we did 3 quality assurance visits a year, and that really gave us time to consider how effective the family hubs were, and were we identifying those families that were experiencing the greatest challenge. This led us on because the family hub, one of the key parts of the family hubs is about the signposting and advice and information that we offer to families. So if we don't know about it, we know somebody who does, and we can signpost. So we then started to record and count the signposting and the advice and information that we were giving to families. We use eStart in Doncaster, so that's one of our recording systems. I suppose the challenge for all of us are the different systems that different organisations have, but we use eStart. And we also then started to count the footfall of people that are coming through the building. So not just the children, but the adults, the older children. That gave us then a more broader view of who was coming through the door, what were the age groups, what were they coming for, and that gave us some real outputs. And then we matched our performance framework to the service delivery, so to the 4 key themes, we matched our performance framework to that. And again, we could see the gaps of what we'd got. Next slide, please. When we started to capture outputs and outcomes, and as I said, we're still, I think Family Hubs in Doncaster now, we've been going for 4 years. And I would say we're probably only 60% part of our journey. And obviously we've had COVID, in the mix as well, so that's probably slowed our thing up. Can we have the next slide, please, Catherine? Sorry. So some of the ways that we collected and captured outcomes and outputs were obviously the quality assurance process that I've just explained to you. That really helped us to do that. The qualitative and quantitative data, we all know we can get lots of data, but I think sometimes the more qualitative data is more important. We've recently had a joint inspection within Doncaster, and they really liked the case studies. They really liked the voice of the child and the family. So I think that's not to be forgotten in collating all this evidence of impact. We use evidence-based tools, particularly in parenting. We use Outcome Star, Family Star and My Star with some of the families that we work with, and that's a really good way of evidencing the work that we've completed. Again, feedback from families and partners. We do lots of audits. I personally think the biggest and best way that we show the impact is from the evaluations that we get from our families. We do a quarterly evaluation of all the services that we run from the family hubs, and that gives us some really good impact data of what difference it's making to our children and families by attending family hub services. And we've tweaked our parental satisfaction survey as well by adding some impact in there. So that's another way that we can evidence that. We have what we call signs of impact cards for all the sessions that we deliver, and that describes the aims of the session, who it's for, why we're doing it, who attended, and what is the impact of everybody that's attended that group. Obviously during the pandemic, we've then been recording lots of virtual support and interventions that we've been doing, so that will be added to this list well shortly actually. Do you want to just move on to the next one, please, Catherine? This just goes into a little bit more detail of how we evidence for each one of the themed areas, so we can see how much we've done. So you can see for health and development, we've done 1,085 signposts, 38 types of service delivery have come under that theme, with 22 professional heritages. And then that list down there is some of the ways that we evidence that. I started off by saying that we started with a very basic spreadsheet. We've now developed that into a data booklet so that we've got all the data in one place, with links that we can go to, and that's from a Doncaster level down to each family hub area level. But as I said, it's the evaluations that I think that give us the richest impact. Next slide, please, Catherine. Oops. So what next for us? Obviously, like everybody, we're considering the impact of COVID and the virtual offer and how much of that will we keep, because that's been very successful for us, particularly our social media presence. And we want to look at how we're going to continue that. In Doncaster, over the last couple of years, we've really, I think, mirrored what we've done in family hubs. The whole local authority is now going to locality working. So that's rooted in people in place, really looking at what's happening in those communities, what can help, what can support. The best Start for Life book strategy, obviously, that we've all seen and looked, what does this mean for Doncaster? How we're going to change our service offer to reflect that and embed that within our service. With our service offer, we've actually got a day looking at that on Monday. And then, as I said, we developed this data booklet that we really like, and that's been great for evidencing and an easy access to all the data. And at the moment, we're currently developing a yearly outcome report. So I was very impressed to see, I think it was Essex last, that looked very impressive. I would be interested to see something like that, because that's the kind of thing that we would like to develop next in Doncaster. And I think that's it from me.
Thank you very much, Denise. Absolutely. And thank you for mentioning SEND. I think that's an area of family hubs that is incredibly important, making it easier for families to coordinate all the care they need. I love what you said about babies as members of family hubs by 8 weeks, not babies attending or on a record, but babies as members. So I thought that was lovely language. Again, I could say a lot, but I really want to move on. We are going to have the full 10 minutes for the Isle of Wight, but we are running a bit late, so I'm going to have to be very tight about your time, I'm afraid, Simon and Rachel, but over to you. Thank you.
Okay, thank you. Good afternoon, everybody. My name's Simon. I work for the Isle of Wight Council. And Rachel, would you like to introduce yourself?
Hi, I'm Rachel McKernan. I'm the Assistant Director of Children's Services for Barnardo's, who deliver integrated early help services on behalf of Isle of Wight Council.
Thank you. And thank you, Samantha, for the invitation and the opportunity to share our experiences, but to learn from others as well. So, Catherine, if we could have the first slide, please. So these are the areas we'll cover. People will see the presentation will be shared. The next slide, please. So just by way of a bit of context, we've got very high levels of need on the Isle of Wight, but a lot of that was plateauing in terms of need. Absolutely due to the family centre and the early help work that's been doing. But as colleagues have said, the impact of COVID, we are seeing rises in terms of need, and hence why early help and our family centres are even more critical and central to what we do here. So the next slide, please.
Thanks. So we were asked specifically to talk about recording and monitoring outcomes. And we started this journey in 2015, and it's very much a partnership across the whole early help system. So across Hampshire and Isle of Wight, there is now a shared outcomes framework, and that is mapped to the 5 Every Child Matter outcomes, but also to include system sustainability around early help. And then every service that Isle of Wight or Hampshire commission or deliver internally work to that same shared outcome framework. So that means that when you're commissioning in that way, it creates the environment and the culture for integration and partnership working, even if you're not commissioning it as an integrated service. So next slide, please, Catherine. So how do we actually in the service track and monitor outcomes? So the Isle of Wight has already established and has good early help system working, and it has a distance travelled toolkit, which is strengths based and works on a 1 to 5 rating scale. And there's a toolkit advice that's sent out to all practitioners, and that's everybody across the system, primary school, preschool teachers, our family support workers, etc. So anyone who is contributing to an early help plan is working to the same set of outcomes and is using the same distance travelled tool to monitor and track progress. So the baseline is established via the early help assessment, and then it's monitored via team around the family plans and reviews, which take place at least quarterly. Next slide, please, Catherine. So on the island, we've also integrated the troubled families, or we call it locally strengthening families. I liked stronger families in Doncaster, but we've integrated that within our intensive family support. And so there, the local Isle of Wight TFOP, so it was the Troubled Families Outcome Framework plan, reflecting the MHCLG priorities, have been adopted into a local Isle of Wight troubled families outcome plan. There's 31 outcomes, therefore, that we measure against related to stronger families, strengthening families, and what we've done is created descriptors for each of those outcomes, so that, as you'll know, monitoring on a 1 to 5 scale can be very subjective, especially if you're using things such as self-reported measures. So this gives a clear descriptor to everybody in the system around where that individual or that family is at that point, so therefore we know if one practitioner's rating a 3, anywhere else in the system, that practitioner would also be rating a 3. So next slide, please, Catherine. So what that enables us to do is to allow tracking and reporting of outcomes on an individual, on a family, but also at a service level. So what you'll see here is 3 different slides. They're quite small, so I'm going to look on my other screen. So the first one is relating to a young person, and it's looking at improved family relationships, but also at satisfactory school and college attendance. Now, what you'll notice here is in the first review, there were no issues identified around school attendance, but what this enables us to do is to add those issues in as and when they come. So you'll see at the second review, we were then monitoring 2 outcomes for this child or young person, and by the end of the year's support, you can see that they were down to 1, which was the best outcome. Below that is a table where you can see outcomes, 2 outcomes being measured for a family across a period of time, and then the donut demonstrates outcomes across the whole service for families. For every outcome that we measured in Q4 for families closed, we were able to demonstrate 87% had improved in their outcomes by moving up those descriptors from, from the worst, if you like, or the least, the least best outcomes towards positive outcomes being at 0.1. Next slide, please. And then with regards to targeted early help, we do use a range of validated outcome measures. So we use the strength and difficulties questionnaires, partners in change outcome measures, and service user reported outcome measures and experience measures, but they're also mapped to our 1 to 5 measuring tool. So we can also put that into our system. That's Bernardo's outcome framework. However, if you've got software and you're using any 1 to 5 measure or system such as Outcome Start, it could be mapped to that as well. Through that, we were able to demonstrate a 96% improvement in outcomes following early help parenting support last year. Next slide, please. And these are just some of our headlines, and we do put together an annual impact report every year. And I think I'm handing over now to Simon.
Thank you, Rachel. I think we started in terms of reporting, saying to senior colleagues, partner agencies and elected members that families don't describe their experiences in terms of key performance indicators. Actually, they describe their experiences in terms of what's happening to them, what they want to achieve, what does a positive outcome look like, rather than actually simply a performance indicator. And so we've actually had to help partner agencies and colleagues come to a very quick understanding about that. And so it's the outcomes that we share to say, this is what your investment, this is what your support, this is what your leadership is resulting in terms of the lived experience of families on the Isle of Wight, that actually, you know, they are being supported to achieve the outcomes that they've identified they wanted to achieve. Next slide, please. In terms of reporting, for us, actually, it's the word of mouth, the social media, that one family says to another family or a family member or a neighbour, actually, do you know what? I needed some help. I went to our family centre and all the help was there. I wasn't chasing around for days, trying to kind of ring, get hold of people, make appointments, have assessments, be on the waiting list, because actually most people would give up. But actually, I think Rachel termed yesterday the sort of no wrong door approach, where actually families are immersed in early help already. They may not know that, but when they need it, it's there for them. Next slide, please. So in terms of actually the reporting, it's very much about sharing the experience of families with other families, obviously within confidence, rather than actually writing endless performance reports about endless performance measures that sometimes I wonder whether people actually read them. Whilst I accept and appreciate that that's important, it's about actually kind of bringing, as I say, families' lived experience to life. Next slide, please. Rachel, you want to?
Yeah, I was just going to add to that we have a Vimeo channel where we have parents share their story, and it's not kind of out there publicly, but they're willing for us to send a video link to parents who are a little bit uncertain about the service. Our seldom heard parents who really are not sure about kind of accessing a process, coming to a group, etc. And we share that link with them, and it's really powerful because that's parents talking to parents, peers talking to peers, and those case studies as well. We have been able to share people's stories more widely in terms of the impact, because that's where the impact sits actually, in families, not in our donuts, however much we like to look at them.
Thank you, Rachel. And then just in conclusion, this is what Ofsted had to say about the evidence we provided and through the inspection that we had in 2018. So, you know, certainly all credit to everybody locally that's involved, and I look forward to answering hopefully some of your questions.
Thank you both so much. I've been badgering the Isle of Wight on and off since 2015 about what they're doing with family hubs, and, as I say, making sure expert advisors in the Department for Education are talking to them, and they have, as I said, tirelessly answered my questions, responded to government. So huge thanks for coming to yet another Family Hubs Network event. I'm just going to bounce straight off your presentation to ask the first question. This is very much my question. We've had some fantastic Q&A, and we will just very quickly on that. We will look at it all. We obviously won't have time to answer everything. We've also been looking at the chat. The panelists have been engaging with the chat. It's been fantastic. But we will look at it afterwards. The webinar will be on our website. The slides will be disseminated. Lots of people have been asking about that. So you will be able to look back at all this at your leisure. If that's the right word, if any of us have leisure. But my first question really to Rachel and Simon is, we're so conscious that developing family hubs is a process, not an event. If they're going to become all that they can be, it's a kind of wonderful evolution. How important is that process of reporting and the dissemination of outcomes that you've mentioned to maintaining the buy-in for that ongoing improvement, increased investment, or even maintained investment from elected members, from officials, etc.? You've got to keep selling yourself, I'm assuming.
I think it sells itself really, because families sell it to other families. And where every time there's a new government initiative or grant funding, actually what we do, we invest in the success that our family centres are already achieving. So actually not only do you get the value for money that you can report back to elected members, but actually you also get families experience a much more integrated, coordinated approach than they would otherwise if we had lots of parallel initiatives that were all reporting separately. So for us, actually, it promotes itself. It definitely does. Rachel, is there anything you wanted to add?
The use of case studies cannot be, underestimated, especially when we're talking to elected members, because they speak the human impact. But I think also being able to demonstrate, for example, the impact on school attendance supports buy-in from education and from other partners, not just in terms of sustained funding, but in terms of sustained commitment to the wider early help system. So it's that, and that again, the shared outcome framework does that as well. We know we're all working to the same outcomes, the same impact for families. We can demonstrate our bit is doing this towards their shared outcomes, then it brings buy-in and it is shifting that culture.
Thank you. Thank you. So a similar question actually has come in that I think is best addressed by Carlina from the first presentation. Because I think the impression was given that you've got buy-in from elected members and officials in order to even embark on that local consultation. But Carlina, the $6 million question for many local authority people who work in family services is how do you get elected members and officials on board a plan to develop a family health model, just getting them off the starting blocks?
Yeah, I mean, early engagement is essential really, so engaging them as early as possible, so pre-consultation, during the consultation, involving them in the consultation, and then obviously feeding back the consultation results. I mean, for us, we did several stages of consultation, and so we did an initial consultation before we even did the business case, and that helped to carry it forward. So actually, by having the message that not only professionals but families themselves were really keen to see this being implemented, it was a really strong message that helped to get the buy-in as well. So just engaging with the portfolio holders for the key service areas that will be affected, the leader as well, briefing them regularly, and also I mentioned in the comms and engagement plan that there was a sign-off process, and just making sure that that was really kind of planned out so that you can engage with each key stakeholder group in the kind of correct order, and make sure that everyone had a view of it, and also making sure integrated governance is part of that as well. So it wasn't just about the local authority governance, but you looked at the integrated ones as well, so that you could bring in health partners, because as you know, family hubs are reliant on a lot of integrated delivery with health partners as well. So another thing is making sure that for Plymouth we had a labour group, so we visited the labour group as well. So it was just a rolling programme of engagement, not only but making sure it's as early as possible with the most senior people responsible for it. And like I said, feeding back the consultation findings is a very strong message, strong way of getting that messaging across, and getting buy-in as well, because if you can show that you've engaged with a wide number of people from across the city, and you can show that the message is generally saying the same thing, and these are the areas that they want to concentrate on, it kind of like the person, it kind of sells itself. You have the message there, the people are speaking, and it's quite difficult to challenge it really.
That's helpful and similar really to what Simon was saying at a later stage in the process. So fascinating. Anybody else on the panel who wants to talk about this? I know Adrian, Haley and Richard in the enviable position of the Children's Minister is actually one of your local MPs, and she's extremely supportive of the Family Hubs model. But again, how did that kick off? Because I don't think she was even an MP when the council started moving in this direction. Anyone from Essex want to contribute there? Can I see a hand? Nobody's volunteering. Adrian, go for Adrian. Thank you.
Sorry. Yes, quite right. So there's possibilities which we now have, which we didn't have in the past, which we absolutely need to realise. One of the things that terrified me when I moved from the NHS to local authorities was the fact that a PowerPoint slide talking about one case study counts for as much as a meta-analysis or a systematic review. And now I've learned to use that to my advantage. I'm in a much better space. So I absolutely agree with what Rachel and Simon were saying. And I think we probably need to get better at balancing a kind of whole population approach in terms of the surveillance and some of the internal work that we do to look at our overall caseloads. But how we report that back, I think using case studies which may take an individual family but highlights all the various touch points across all the various agencies which they need, can be summed up very, very quickly and very effectively. So yes, I think, you know, we need to turn the message into something which is easy to hear and is as appropriate to the audience as it possibly can be. And that is very different than the data sets that we normally report up to government.
Thanks very much for that. I'm going to stay with Essex, if I may, for the next question. We've had it's the interface with Family Hubs and the Ledson review, which was very positive about Family Hubs. It was one of their 6 action points, and it's about we talked about identifying the relevant cohort, but there is strong political pressure, including from Ledson, especially from Ledson, to make this a universal offer. And I'm conscious of what Adrian said about universal as a word, but anyway, given how tight the money is, how realistic is it that Family Hubs will give something universally? And Richard, the way you've integrated health into your Family Hubs, I think is fascinating, because obviously health is a universal system. Any comments to make on that?
Yeah, sure. Thank you, Samantha. I think if I just go back to one of my slides where I think it was Hayley that said we use the universal contacts as a touch point to identifying those who may require additional or enhanced support. I think we need to realise that not all services have either the funding behind them or are serving a population with sort of high need or complex need, whereby the universal provision is under strain. And there's some areas in the country where some of the, if you like, the mandated checks have been sacrificed in order to preserve universal provision for chosen contacts and to ensure those that do have who have complex needs get the support they need. I think what was helpful in Essex was Adrian and his colleagues in Essex County Council made very clear from the outset, and they're able to do this because we are an integrated co-commission service, but they made very clear from the outset that they weren't commissioning a health visitor service. And that wasn't to disrespect the Institute of Health Visiting or the professional role of health visitors in any way. Quite the opposite, really. It was to highlight that they wanted health visitors to use their incredible knowledge and expertise and experience in supporting those families with the most complex needs. So where their influence would be felt the most and have the biggest impact. So that's brought into question how we formulate multidisciplinary teams. Who does what from the multidisciplinary team? What are the competencies we require of staff that aren't qualified health visitors to undertake certain contacts? And it's allowed us, I think, to go through, particularly in this COVID period and the and if you like, the relaxing of the COVID restrictions and the coming out of the lockdown, where we've seen a surge in activity. I think it's allowed us to ride that storm reasonably well, because we haven't suffered as badly as perhaps some of our neighbouring services. So I'm not professing to be an expert on this, or I'm not advising any providers or their commissioners to take one stance or another, but what serves well is looking at things at teams, not from a professional role perspective, but a multidisciplinary approach where you can get the most out of your skill mix, but also ensure that you channel your most qualified, your most appropriately trained staff for those that benefit from it. Hope that's helpful, Samantha.
Yeah, very helpful. Adrian, I can see your hand is up. Is that, yeah, you please do.
I just wanted to very quickly just add to that. I think it's really, really important that we don't reduce the kind of looking at a differentiated response to the issue of money. So a kind of triage approach should not be driven by money. I mean, I think we should be doing that even if we're all awash with money, quite frankly. And by that, I mean that there will be some people that the main intervention they will need might be a professional intervention or a clinical, medical intervention. There'll be others where what they need is a bit of social support, and it doesn't need to be a qualified professional. Now that is not, so there's a, if you like, a triage or a front-end triage process, which is based on need rather than the need to better or more severely restrict current resources based on less funding. They're two very different things.
Great, thank you. I like what you just said because it really led me into a couple of other questions where I'm going to come to Denise on because it's about deciding the relevant interventions. And one question, I'll ask them both together. How can we balance the need for outcomes to demonstrate success with human need for connection that's more difficult to data catch? And that's kind of all about this kind of relational culture, which is a key principle of family hubs. And so because an intervention isn't always a program or something that's as amenable to evaluation as we might like, the second question, I guess, related to that is, what standard of evidence do you require before adopting an intervention? So we mustn't be fixated about gold standard, but we still need to be, that what we're going to do is going to make a difference. Thank you.
Yeah, I mean, I think that's a really difficult question, but I'll answer it as best as I can. I think it's, what is an intervention? An intervention could be somebody coming into a family hub to use the washing machine. Hopefully that would lead to a conversation that would then lead on to further support for that person who needs the washing machine. Why do they need the washing machine? Why have they got into that space where they haven't got a washing machine in the house and they need to use it? They may then ask to use the food bank. All those interventions that to me, that is an intervention because that has supported that family at their time of need. What the difficult thing for that is measuring that outcome on that family, because that could have a significant, just using the washing machine, could mean that child isn't bullied at school because of the clothes it's wearing the next day, or the self-esteem of the parents because they've got, and that's the difficulty. I think it's got to be based on need, and it's got to be based on what's in front of us. I think data's fantastic. We all love data, don't we? Love it and hate it. And data can tell us lots of things about communities, but nothing can tell us more about communities than the communities themselves. So what is happening in that community? What's happening? What's impacting on that, not that community, that person, that family, and then on that child. And I think for us, if an intervention would be, in that case, letting them use the washing machine. Something else might be that we know from local intelligence and data that perinatal mental health is quite topical at the moment for us in Doncaster. I'm sure it is in lots of areas, that is a need for us in Doncaster. So that is something that luckily has come alongside a new service being provided, and we are able to offer that. I think the difficulty is when the other resources and services aren't there. And then the other flip side of that is evidencing that impact that you've had on that family. And that's why I think case studies alongside data are really important.
Thanks, Denise. And it was a difficult question. Well done. Rachel, I've seen you nodding so vehemently. I really must give you an opportunity to say something.
Yeah, I mean, I think that the tack we take on the Isle of Wight is that every interaction is an intervention, taking a very trauma-informed lens with regards to that. And I think picking up on the universe, or however you get people into the centre to get those relationships going, is the key to that, because as someone said in the chat, it is the relationship that heals. Where there's relational trauma, it requires relational repair. And certainly in Family Hubs, a lot of what we're working with is families who have experienced relational trauma. So someone's asked about how do you actually monitor that and how do you check that kind of relationship. We use the PCOM suite when we're doing one-to-one work, because that has a session rating scale which does exactly that. It kind of tests the relational kind of alliance between the practitioner, and whether it's validated for young children and for adults. And so it tests that at the end of each session and allows a conversation to happen. You know, did what we cover meet your needs today? If not, what would meet your needs? And so in real time, you're enabling the practitioner to attune with the family or with the individual that they're supporting. And that really shifts practice as well to be very attuned and responsive. And we have to measure outcomes, you know, because that's what we are held to account on, and we have to measure KPIs. But our families don't necessarily know that we're doing it.
That's interesting. Yeah. Simon, anything else to add from the Isle of Wight?
No, thank you, Samantha.
Okay, that's good. That's absolutely fine. I think moving on to Adrian, this is to me a really important question that's come in, and it reflects the kind of tension between measuring outcomes which reflect local rather than national strategic outcomes. And when we are, I know the National Centre, the government is keen that there is something standardised, if you like, about that Family Hubs are working to, so we know we're not measuring, comparing apples with pears. But you talk a lot about flexibility, and that was something that really came through the presentations very well. So how will the framework ensure we're measuring the same thing if delivery by necessity is differing across local authorities? So Adrian to start with, and then perhaps Hayley to come in as well. Thank you.
I think that's a really easy one to answer. No, I'm kidding, Samantha. I think, so firstly, let's recognise what some of the common outcomes are. So we're probably, I hope we're all interested in, you know, school readiness. I hope we're all interested in the number of overweight or obese children that we've got. And so, you know, would I want to mess with, for example, the National Child Measurement Programme? No, because that's a national surveillance tool. So I think we need to recognise measures that we think are important and kind of almost revalidate them. That's not to say that we couldn't potentially revisit some of the detailed KPIs around them. But I mean, what I would really love to see, and maybe this is this webinar is a bit of a catalyst to try and do some of this going forward, is a sort of national expert-led process which ruthlessly challenges the current activity measures, which may be uniform, but they are, I don't think, particularly good proxy measures of outcome. So we shouldn't overrate the fact that they are uniform across the country, because that's not an outcome. And then we could look at what are the outcomes that we want to get to nationally, and then look at some kind of, as I say, expert-led symposium process. I say expert-led, I include in definition of experts, children and families themselves, to work back from those outcomes and get the best proxy measure that we can. So that's something that you know, we other speakers, and I'm sure others on the call, have probably thought about doing locally, and I think that's important to do locally. But if there is a way of coordinating that process nationally, I think that would be really good. I think that's needed. I think it would need to be cross-organisation, not overly influenced by any one institution or organisation, and ideally independently chaired. And then I guess the only other thing to say is, I think it's worth trying different outcomes, different key performance indicators in different areas as pilot sites for different approaches, but as part of an overall coordinated research program, I guess. Ideally sponsored by government or through the LGA, but done through a coordinated program.
It's interesting, yes. Haley,
I might come in.
Okay, dive in. Yeah,
I mean,
not too long, but yeah.
I won't be long. I mean, I would agree with Adrian on all those points, but I guess I would err away from being prescriptive. I think you can probably, as Adrian's described, have cross-cutting things, or you know, ambition for certain outcome measures you want to achieve that will be the same across geographies or towns or cities or counties. But it's how you achieve them needs to be left unprescribed, because the interventions, if that's what you want to call them, or the things that might help people or make them better or help communities should be local. And so whilst the outcome heading might be school readiness or perinatal mental health or resilience of a school-aged child, I think it's how you do that I would leave up to local people and local systems and organisations and communities. So yeah, there you go.
Thanks, thank you very much. Haley, would you like to have the last word in the Q&A? No pressure, eh?
Well, I'm not sure I can top Richard, to be honest. I think they've wrapped it up nicely. It's, you know, it's just great to see everybody's journeys and to see everybody's thoughts and where they're coming from. So I'm not sure that I have anything more to say on that, I'm afraid.
No, that's absolutely fine. I think we're very, very close to the end. So probably just as well you didn't go off on another and open up another seam of information. But thank you so much. I really must thank every single one of our presenters for the stellar presentations. And I do think, as I said, each one of them is very important in its own right. And so it's going to be important to look over the slides. We're looking at the questions. We've just scratched the surface, as you know, of the Q&A. So we'll pore over that, and we want to use some of those as frequently answered questions on our website. So to spur us on to get some more answers, because these are really important for our information bank, so that people can go to our website and find out all they need to know. But just, you know, to thank people by name: Carlina from Plymouth, Richard, Adrian and Haley from Essex, Denise Beavers from Doncaster, Simon and Rachel from the Isle of Wight. Really, really appreciate all you've done today and all you keep doing in the background. We've had incredible technical support from our very own Catherine Barker, our head of development, who you all know very, very well. You know better than you know me, which is great. You all talked to her. Many people on the call, the attendees of the webinar, will also have talked to Catherine. Leslie Payne, who's been spotlighting and just keeping us on the technical straight and narrow, from our partner organisation, Care for the Family. We really appreciate you and them for giving you the time. Everybody has very kindly put their email addresses on their slide deck, so don't hesitate to get in contact with them. It's easy for me to say that, isn't it, to volunteer your time to answer questions. But we are also very open to answering questions or fielding questions, just like a family hub. We might not have the answers sitting in our office, but we know where to find those answers. So any observations, contributions you've not been able to kind of formulate on the Q&A or on the chat, do send them through and we'll get back to you as soon as we can. So Thank you again. It's 3:30. We've actually ended on time. Thank you so much and enjoy the rest of the day. And go on the Family Hubs Network, beg your pardon. Go on the National Centre website that is opening in half an hour's time. Thank you so much. Bye then.